Thanks, Nuri. Thank you so much, Marlene, for joining us for this little seminar on a not so little issue. When I ran for Congress the first time in 2018, this was the number one issue, and it only wasn't in 2020 because we had a global pandemic. So maybe it was number two, and people were concerned all across the district I represent about the state of our healthcare system, about access to healthcare, obviously wanting to make sure that everybody has health insurance in this country, but also the affordability of that access. The Affordable Care Act is something people wanted me to support and defend, but many people felt very strongly that it was not really all that affordable, right? And they were right, particularly for people who had to go out and find coverage for themselves on the marketplaces. So a lot of us running that year promised we would do something about it. And finally, this year, as we have been emerging from that global pandemic, I think we delivered in a really big way on that promise, passing the American Rescue Plan, which has some really extraordinary provisions that have not gotten enough attention yet to lower the cost of health insurance for folks across this country who have been struggling to afford it for so long. We'll talk about some of those details. We'll talk about the practicalities, how people can go about benefiting from these changes. We're not done yet. What we've done is basically to make things more affordable through greater subsidies and caps. The government's going to be helping out. We have not fundamentally reformed the healthcare system in America through this legislation. We haven't really dealt with the fact that healthcare costs Americans a higher percentage of our national income than people in any other wealthy, successful country in the world. We've just redistributed those costs so that it's fair, and so the burden on us as individuals is lower. So I'm really, really proud of what we've done. We're going to talk about it today, and then we're going to go on to the next step, I hope, over the coming months, and try to make the structural changes to the system that are so needed. But we want to start with a few questions for you, Marlene, as our resident expert in the state of New Jersey. And hopefully, just you and I will talk a little bit, and then we'll shift it over to all of our guests to ask follow-up questions. So, as I mentioned, we passed the American Rescue Plan to make health insurance more affordable for folks who are shopping on the health insurance exchanges. And in New Jersey, this new financial help is available through our state exchange, Get Covered New Jersey. Our marketplace in New Jersey opened just about 6 months ago, and that changed the way that we in New Jersey get insurance under the Affordable Care Act. So can you start out by telling us a little bit about that transition from healthcare.gov, the national Obamacare exchange, to Get Covered New Jersey, and what that means for us?
Yes, of course. And Congressman, thank you so much for having me here with you this afternoon. Governor Murphy, when he came in and under his leadership, made the access to health coverage a priority. For him and for the folks in his administration, we believe that it's a right to have health coverage. And so a big part of our work was, how to provide New Jersey residents with the ability of being able to access quality, affordable health care. We began this transaction about a year ago, trying to move away from healthcare.gov and then forming our own Get Covered New Jersey. And back a year ago, when we started the transition, we never imagined that we would be doing it in the middle of a pandemic. That was, we started it prior to the COVID pandemic, and we were able to do it through this pandemic and provide the ability for our residents to have access to a platform that was tailored specifically for New Jersey residents. And that's how we're different from healthcare.gov. We were able to take our platform, our marketplace, and make sure that we are addressing the issues that affect New Jersey residents. And for those that are not familiar with the marketplace, with Get Covered New Jersey or with healthcare.gov, that is the marketplace where individuals, residents of New Jersey who do not have coverage through their employer or through any other program would go once a year to purchase insurance coverage. And when we were on the healthcare.gov, we only had a 6-week window. When I say we're able to tailor it to the needs of our residents, and that's exactly what we've done, is that we are now, our open enrollment was November 1st and it closed January 31st. But because of COVID and the pandemic, we're able to do more for our residents, and we've extended it where we couldn't do that through healthcare.gov. We've also been able to provide state subsidies for many of our residents on top of the federal aid, the federal tax credits that were available under the Affordable Care Act. But again, thanks to the wonderful work that you've done, Congressman, in DC, with the American Rescue Plan, there's now more tax credits on the federal side for individuals that go on the marketplace on Get Covered New Jersey and purchase insurance coverage. And we've, as the state, have been able to use our subsidy in a wider, and I think in a better way, where we're now able to provide assistance also for individuals that before would not have received assistance. This is so important for New Jersey residents. The work of the Affordable Care Act, combined with the American Rescue Plan, because there is now, for the first time, this ability to purchase quality, affordable health coverage here in New Jersey.
Yeah. Well, let's talk about specifically what that means. As you alluded to, the Affordable Care Act historically has provided some financial help, right? Some subsidies to folks on the exchanges who earn below a certain annual income. So say a little bit more about the new financial help available based on the bill that we passed and what it means for New Jersey residents.
Sure, of course. So previously, residents in our state who earned up to a certain income level. So for example, if you were a single individual earning $51,000 or a family of 4 earning $104,000, you would be able to get financial help to lower the cost of your coverage. The American Rescue Plan has helped to increase the amount of financial help that these residents can receive. And it's removed, though, which is the beauty of it, it has removed income limits that were previously in place so that individuals and families with higher incomes would not be eligible for assistance. That has been removed. It's kind of technical, to be honest with you, the law, but the bottom line is, regardless of your income, all residents shopping on the exchange are eligible for assistance through the federal tax credit so that the benchmark plan in their county does not cost them more than 8.5% of their income. Basically, the bottom line is that there is more financial help for the residents of New Jersey. On top of that, we could layer it with our own state subsidies so that we now have state subsidies available to individuals with a higher income level, where before they may not have been eligible. Basically, the bottom line again is that 9 out of 10 residents that enroll through Get Covered New Jersey are going to qualify for financial assistance. There's big savings available for everyone also who has received unemployment compensation in 2021. So the beauty of this new law, of the federal law, is that it's covering and protecting the individuals that were unemployed as a result of this pandemic. And it's also providing more assistance for New Jersey residents. It's providing assistance, financial assistance for individuals who would not have qualified under the Affordable Care Act as well. And then we layer that with the state subsidies that Governor Murphy was able to put through and sign into law to help our New Jersey residents to make healthcare coverage here in New Jersey affordable.
Right. So what would that mean, like specifically for out-of-pocket premium costs for typical folks in our state?
So, so most folks that enroll in a plan are going to see lower premiums. And we estimate that about 2 out of 3 individuals shopping on our marketplace on Get Covered New Jersey can find plans that are $10 or less a month. Or they can change it for a plan that's much richer with benefits for about $50 or less. I am not going to say that all the plans are like that, but for the folks that qualify for the financial aid, or for the financial assistance before, should come back on and look to see how much more they qualify. And for the folks that did not qualify before, should definitely come back on because they more than likely also qualify. And what they could do is they could use the shop and compare tool that we have on our website to see the different plans that are available. They could see what kind of assistance, financial assistance they would get from the federal side as well as from the state side. And then they can make a decision as to changing the plan or actually buying a plan, because while, you know, open enrollment ended January 31st of 2021, we then extended it till actually May 15th for the pandemic under COVID. It's the COVID-19 pandemic, special enrollment. But because we want all New Jerseyans to be able to take advantage of the financial help that the American Rescue Plan is offering, we've extended the open enrollment till the end of the year. So if you don't have insurance, you can go get insurance, and you'd be surprised at the savings you could find with the plans. You can shop, compare what's best for your family and for you. That is, you know, what's available for you. The out of pocket, again, it would depend on the plan that you get, but we're talking about available plans that are $10 or less or $50 or less.
Yeah, I mean, and we've run some of those numbers for folks at different income levels, and you know, a big difference here is going to be made for people who didn't qualify, as you mentioned, for subsidies before. Like, you know, if you're in between that $50,000 to $120,000 a year annual income level, again, depending if you're single or a family, for a lot of folks, you know, you're not going to find health insurance for $30 a month. You may still be paying $500 or $600, but that's hundreds of dollars less than you would have been paying under the previous law.
Absolutely.
So it's a really,
Absolutely.
really big deal. You talked a little bit about the open enrollment, which is a benefit of having our own state exchange, right? That we get to set our own time period. And talk about, like, you know, folks have questions. There are navigators available, right? Who can provide assistance if you go to the site.
Absolutely. As I had mentioned before, and as you just mentioned, Congressman, the beauty of having our own exchange is that we could tailor it to the needs of our residents. When we were on healthcare.gov, we had to follow the rules of the federal government, and they kept shrinking with the previous administration. So we went 2 years ago, we only had 1 navigator for the entire state. Today, we have 16 navigators for the entire state, and they can speak to individuals in different languages. we were able to extend our open enrollment for the COVID pandemic until May 15th. Our governor had asked the previous president to do a special open enrollment during the height of the pandemic, and it was denied, it was refused. So we're addressing the things that should have been addressed earlier, and it's because we have our own exchange that we are able to help New Jersey residents. Open enrollment, like I had mentioned before, it's the one time of the year where individuals who don't have insurance, health insurance, can purchase health insurance. Of course, if you have some kind of major life change, for example, you got married, or you moved into the state, or you just had a baby, then you could have a special open enrollment. But overall, it's the one time of the year that you can buy insurance. And we've extended that window from November to January, whereas before it was just 6 weeks, starting November 1st. But again, because we're able to control and tailor our platform, we have a special open enrollment for COVID, so individuals can still purchase insurance. And then because of the wonderful work that you did with our colleagues, our federal colleagues, we have now extended the enrollment period, the special enrollment period, to the end of the year so that they could take advantage of the extra credit, the extra tax credit available to our residents. So it's really important. We have navigators. Like I said, we have 16 navigators that if you're not sure of the plan, if you have questions, confused, they can help you. They will pick up the phone, they will help you. I wouldn't say that you can go in person because we still have the pandemic. Definitely they can help you, on the phone. We also have a call center. We have a call center where the call center is in New Jersey and the staff are New Jerseyans. And so one of the wonderful things about having this exchange is that New Jersey is benefiting by employment as well. So if I sound excited about the program, Congressman, I'm very excited about this program because it's the first time in a long time where we're able to bring real relief to the residents of New Jersey. Bearing in mind also that this year we did better as far as the premiums. They were lower than when the program started in 2014 when the Affordable Care Act came into play.
Yep. There's a lot there, and bottom line, you can get a lot of these questions answered by going to getcoverednewjersey.com. You can, do the calculator on the site to compare different options to see what will work for you. There's a call center. You can also just ask your congressman and your commissioner directly because you've got us right here. So to heck with a call center for the next 40 minutes, you've got us. And I think, why don't we, with that, see if there are any questions from any of our guests. Back to you, Nuri.
Great. Thanks, Tom, and thanks, Marlene, for answering some of the FAQs we just went through. We are now going to begin live questioning. So if you have a question in regards to this topic, please use the chat feature at the bottom of your screen to first ask your question. Please include your name and the town you are from when you do so. I will let you know when you are up next and call on you to unmute and ask your question. To start, we have Veronica from Long Valley. Veronica, can you hear us? Veronica, do we have you?
Oh, I hope so. Can you hear me now?
Yes, we can.
Okay, great. Thank you for doing this. It's important. Healthcare is like a primary issue for everybody. And I see that there's a lot of people attending today that are curious about it. I did have a few questions. My first one was about the 8.5% cap. When did that become effective? Because the American Rescue Plan wasn't effective until later in the year. So now is that 8.5% going to be applied throughout the entire year, or is it going to be dated only since the American Rescue Plan went into effect?
Congressman, would you like me to answer it or?
Yeah, go ahead.
So my understanding is that it came into effect and it's retroactive, and the congressman, please keep me honest. I know that the additional credits that folks can get online is also retroactive to the beginning of the year. So we're working on that.
Okay. And the other thing that I wanted to say about the subsidies, because Tom knows that I'm a pain in the neck about this, is that, you know, when you say, like I noticed under, you know, since it's moved to Got Covered New Jersey, that 9 out of 10 people qualify. At least that's, I have Verizon, Blue Cross Blue Shield of New Jersey, and I got that email the other day that 9 out of 10 qualify for subsidies. And that translates to 9 out of 10 people cannot afford their insurance. And taxpayers are picking up the tab for this, not the insurance companies. They're not writing them off. It is not making healthcare more affordable. It's making premiums affordable at our expense. So I think that there's some reality with the Affordable Care Act that it is not affordable and it's not getting down healthcare costs.
That's a very fair critique, Veronica. As I mentioned at the top end, we are not. We have not reformed healthcare in America with this bill. And the fundamental problem, in addition to it's just complicated and there's still people who don't have health insurance, is that Americans pay around 12% of our national wealth for healthcare.
More than that. So much more than that.
Well, there may be different measures, but the important thing is the comparison I'm about to give you, which is that most wealthy, successful countries around the world pay about half of what we pay in terms of our national wealth.
And they get care for it. We're paying a lot in our property taxes, as you also well know. I live in Long Valley. I'm paying over $1,100 a person for private health care insurance premium.
Yeah, I know.
So we pay it in our property taxes, we pay it in our state and our federal. And I really would respectfully ask that you consider Medicare for all.
Well, there are a lot of ideas out there for structural reform. Medicare for all is one of them. I think the more likely first step, as many of you who attend my town halls know this is where I stand, is to give every American the freedom to buy into a public option like Medicare.
Public options can still be canceled and you can lose your coverage when you need it most.
Well, actually, under the Affordable Care Act, your coverage can't be canceled. But in any case, I acknowledge that this does not address the national problem of how much healthcare costs the country.
And how the majority of Americans feel about it. And you guys have control right now. You can really do something, Tom, please. You gotta know. As a taxpayer and as a person, I am one of those who now, I paid over $121,000 in 4 years. That's why I'm a pain in everybody's butt about it. I want everybody's kids to have health care.
Understood. You will not be paying more than 8.5% of your income.
For premiums, not for health care. There's a big difference between premiums and health care. Big difference between premiums and health care.
Let me finish. Your taxes are not going up, right?
Our premiums go up, taxes will go up. Expanding the ACA expands our taxes.
Actually, in this case, no. Unless you're making more than $400,000 a year.
Who pays for the subsidies? Who pays for the subsidies?
Well,
Actually, if you don't mind, Congressman, the
go ahead.
state subsidies are being paid through the carriers. It was money that was being sent to DC, to the federal government, and we have diverted it to the state of New Jersey. So the state subsidies that are being provided on the platform to our residents that qualify is paid by way of the carrier.
The insurance companies are paying for the state subsidies.
It's money that they were sending to the federal government, and they are now sending it here to New Jersey.
And then the next steps that we are proposing, you may have heard President Biden in his speech last night. We are going to push for greater healthcare reforms that would be paid for by the Medicare drug negotiation bill. So
Yeah.
HR 3, which is a bill that allows Medicare on all of our behalfs to negotiate with the drug companies for the cost of drugs, not only saves consumers money, it will save the taxpayers about $400 billion over 10 years.
I
And so
agree.
our proposal is to apply that to some of these changes that we are making. And
I
again,
agree with all that. I agree with all that. But
there's
you
more
have
we
to
need
look.
to do, but we're very much aware of the problem that you
Well,
raised.
and the one final point is people who cannot afford their premiums also are likely to not be able to afford their deductibles, and that's true in my case.
Yep.
And so, yeah, it's got to change.
I know
Thanks.
this is a big step forward for a lot of folks. I want to make sure people know. All right, let's go to the
All right,
next.
thank you
next question.
both. Let's move on. Next, we have Maria from Clinton. Maria, can you hear us?
Yeah, it's actually Maria and Bob, and I was the one that asked the question. How you guys all doing? All right?
We're good. Good to see you both.
Good. Doing well. Doing well. The reason I'm here today is to clear up a lot of my confusions. And yes, it is a very, as you said, Tom, it's a very complicated issue. And I'm on Medicare, so I'm fine. But my wife is detached from her job, so she's without benefits right now. And we've been actually searching and looking on the web and trying to figure out how we can get her benefits. And to me, I found it to be a complicated process because I started out with the federal refers you to the state, then the state brings you to familyorg.com or whatever it's called, and then they refer you, they say if your income is too high, you have to go to this other website. Then when you fill out your information, you start getting zapped all over the place to different carriers. That's the way it happened to us anyway. And I wasn't sure how to proceed with that. The last thing I also, when I was in the New Jersey website, I found it's a link in there that's called the New Jersey Medicaid Program and Estate Recovery form. And it talks about anyone that receives Medicaid, correct me, Marlene, if I'm understanding it wrong. Anyone that's collecting Medicaid that no longer collects it because they're either deceased or no longer on the program, liens can be placed against your property to recover the medical care and benefits that you've received from Medicaid. That kind of concerns me, and I wanted to bring that out to the attention of everyone on the Zoom call today. And perhaps you can explain that better to me, how that works and how it's not going to hurt us or it will hurt us or whatever.
So if you don't mind, Congressman,
Yeah.
Bob and Maria, with regards to Maria not having coverage right now, direct you to our website, the getcovered.nj.gov website. You will not be bounced around. That is the website for the platform here in New Jersey.
Okay.
And there we have the anonymous shopper, which you can look at different plans. It's a shop and compare tool. You could look at the different plans. You would also look to see, based on information that you're going to plug into the computer, into the program, what kind of tax credit you will be available to you, not only at the federal level from the Federal American Rescue Plan, but also if you qualify for monies from the state subsidy plan as well. All that would be given to you right there on the system. Sometimes computers can be a little confusing. The programs can be confusing. And I say that because I didn't grow up with a computer. I grew up with a typewriter. So I'm learning as I go. We also have a call center, and sometimes it's nice to speak to a person.
Do you have that number?
Yes. If you have a paper and pencil,
I'm ready.
it's 1-833
Okay.
677 1010.
It's in the chat.
Oh, I see it now. I'm sorry.
Yeah.
Thank you.
And
Okay.
so we have individuals at the call centers that will assist you. They can go through it with you. Again, we'll give you the answers that we have. We'll try to help enroll you. We can give you an idea of what kind of credits you qualify for. And we also have, if you're computer friendly or program friendly, in our website, we also have the navigators. It's like to locate, and so you can find a broker if you want to work with a broker, or you can find the navigators as well. And they go by like what county you're in, so that you could find someone close to you. It's the button that's called Find Local Assistance in the program. And so they could also give you information for a navigator, which is all free, their phone number, a broker if you want to work through a broker, which again, it's free. And then of course, if you want to actually speak with someone at our call center, you could call up. I think that you'll find something there. I know that we've been able to help a lot of folks. Now, Bob, with regards to your question concerning Medicaid and a potential lien if you're not using it, I wish I had an answer for you. I don't. That is not my field as far as Medicaid goes. We work with the Medicaid office to make sure that anyone coming into our platform, if their income is lower, we will send them over to Medicaid, because we don't want anyone to miss out on an opportunity to have health insurance and health coverage. I would be more than happy, by way of the congressman's office, to try to get you some information to the question, or at least a contact person that you can maybe reach out and speak to, so that they can explain that to you, because I don't want to give you any information that's incorrect.
All right, and just to make sure I understand, so if I'm looking at Get Covered,
It's
NJ.com.
getcovered.nj.gov.
Okay, so if I'm looking at that, are those plans affiliated with Medicaid, or are they just the insurance companies offering that insurance?
So these are all plans that are being offered by the insurance companies.
Uh-huh.
And you could look at them, you could shop and compare. And what will happen is that when they ask you for your financial information, if your financial information is at a lower level where you would qualify for Medicaid, we will basically walk you over to Medicaid. And then Medicaid will handle it there and provide you with the information of the carriers that they use and the plans that they have.
Okay.
If your income is a little higher, and you would qualify under our programs, you would have a large selection, of which you could also even look under your doctor's names to see if they're covered in your plans, your pharmacist, the medication, not the pharmacist, the medications, and your doctors. So, I know some folks have gone in and checked to see if their medicine is covered or their doctors are in network. So those are things that you could do as well.
Can I also, like, if, as I said earlier, I have the Medicare, but my prescription plan's not bad, but let's suppose my wife now gets signed up through the insurance company, through getcovered.nj.com. So can I go on her prescription plan?
No, it would just be, I'm not aware of that happening. It would just be to her.
Okay.
The
Yep.
plan that she would buy would be for her. And she would then have the ability to get her medicine through that plan and that coverage.
Okay,
All right.
Thank you.
thank you.
Thank you both. Really
Thank you.
appreciate it. And I did put that phone number, that call center phone number, as well as the online site for Get Covered NJ if you need that help. So that is in the chat feature. Yes. And we will go ahead to Sterling. Let's go to Gino from Sterling. Gino, can you hear us? Gino, do we have you on the line? All right, no problem. Oh, Gino, we have you.
It wasn't unmuting despite my efforts. I have two questions, if I may.
Yeah, go ahead.
Both my wife and I are self-employed, so when the marketplace came out, we were getting our insurance through the marketplace. I turned 65 in 2017, so they notified me that I was no longer eligible. Now, my wife turned 65 this February, and we knew that the policy was being transferred to New Jersey. But despite talking to them in December, January, and February to get the policy canceled, they continue to bill us. They billed us for February, March, and April, and showed us the past due. And we also got a bill for May, but it doesn't have any past due. amount on it. We actually had our attorney write them a letter. All we want is the policy canceled and just verification that the policy was canceled because we opted to cancel it, not because we didn't pay our premium. And we spent hours on, I'm not exaggerating, hours on the phone with people. We spoke to Mr. Representative Malinowski's office today, and somebody's going to handle something over there, but they want us to, send them more forms. All the forms we've been sending out and getting, I have to scan them and send it in. I just don't understand, why it's taken this long to get these people to, process it. Whereas when the marketplace handled it, they told me a month before my birthday that I was getting kicked out. And the other question, before you answer that, is there any concern about tort reform with any kind of bills that involve insurance reform? That's Mr. Malinowski.
Yeah.
Go ahead. Why don't you start Marlene with there?
Thanks, Congressman. What I would say is, Gino, if you don't mind, through the Congressman's office, if they could provide my office with your name and a contact phone number, we will work with you to see about this carrier that's charging you and what is going on. So we will work directly with you. As the Commissioner of Banking and Insurance, one of the things that we also do, aside from having the platform at the department, is we also work with our consumers when they have issues with carriers. So please feel free, if it's okay with you, for the Congressman to provide me with your information, and I will have my team work with you to, get control of what's going on with the carrier that you're using. And then I'll just send it back to the Congressman on the tort reform. I'll let him answer that one.
Oh, thanks a lot. And Gino, the only form you need to fill out with us is it's a simple privacy waiver that we have to, every time we take on somebody's case, they just have to sign the thing saying that it's okay for, it's like, we're representing you as a lawyer, like it's okay for us to use the information you give us. That's all, really simple. So we'd be happy to help through Marlene's office or in any other way. Sometimes we'll call a company and yell at them, but we'll figure out with Marlene what the best way to make this go away for you. And then on tort reform, I don't know. I mean, that's been part of the debate on healthcare, on the healthcare system. It does fall a little bit on partisan lines when we talk about healthcare costs in America. Democrats are often, looking for more market choice, market negotiation for drug prices, giving folks the freedom to buy into that public option like Medicare. Some folks obviously want to go even further and have Medicare for all, so there's a single payer for everybody. And Republicans tend to say, well, we also need fewer lawsuits, and so they propose tort reform. My guess is that if we ever did really serious structural reform of our healthcare system in our country, we'd have to do a little bit of both, right? Because we're closely divided in the Congress. One side can't get 100% of their way on anything. I'm a member of the Bipartisan Problem Solvers Caucus in the House of Representatives. That's kind of the room where it happens, when bipartisan solutions are possible. And I'm always willing to give a little bit if I can get, fundamentally the things that I'm asking for. So I think it really depends on whether we have a real opportunity to do healthcare reform beyond just the Affordable Care Act. And if we do, my guess is that the tort reform will be part of that conversation.
Just one more thing with respect to cost of healthcare. 15 years ago, a friend of mine, a neurosurgeon, he stopped doing surgeries. He stopped administering medications. All he did was exams. His malpractice policy dropped to $60,000. It's half. So if medical doctors and facilities are paying a lot of money for their malpractice,
Yep.
It's going to reflect in cost of insurance, cost of services.
It is. It is part of the explanation for why our healthcare costs are so high, but it's not the biggest part. Like if you actually look at all the different components of the system. So should it be addressed? Yeah, I agree with you. But it's not like the magic wand that's going to solve the problem.
Thank you.
But thank you for raising it. It's important.
Yes, thank you, Gino. And Gino, I put our casework form in the chat to you. I know you said you were in contact with someone from our office, but in case you haven't filled that form out, I direct messaged it to you as well. So please fill that out and we will get in contact.
Thank you.
No problem. Let's head to Rachel from Westfield. Rachel, can you hear us?
Yes, I can. Can you hear me?
Yes,
Yeah.
we can.
Okay, great. Hello, Congressman. So my question concerns my son. He's going to be 26 next month. So obviously we are concerned about getting insurance for him. He has had a number of issues, surgeries, physical therapy and stuff, so he still need a lot of care. I know obviously COBRA is an option. We want to look into the New Jersey healthcare for him. But one of the things that I think is a little tricky is that he may be moving to Philadelphia because he's a student at UPenn, and he may be moving to Philadelphia in the summer. Is it, I guess it's not transferable to students if I were to get him, sign him up on the healthcare, the New Jersey plan, then he moves over to Philadelphia. Would he lose coverage at that point? Does he have to start over again? Does he have to start with just, the basics federal ACA? Do I have to go look into Pennsylvania? There's a whole bunch of options and I'm not really sure which way to go. And the other thing is that I'm seeing on the website, I've done some research and there's a DU 31, dependent under 31 for that may be available for students who are still listed as dependents. So I'm not really sure which direction to go and what he would be eligible for.
Okay. And would he still be a dependent on your tax returns?
Well, I mean, he files his own tax returns, but he has no income. So I'm not really quite sure whether we list him as a dependent or not. I'd have to see what my accountant did.
Marlene, what's your guidance here?
So, and thank you. You have a lot of good questions there, Rachel.
Thank you.
Don't mind my saying.
Well,
Okay. So what I can say is, and I have a friend of mine whose daughter turned 26 and she had to get her own plan.
right.
Her as independent, but in a similar situation where she was still in school, like your son,
Right.
She's in New Jersey. And in this particular case, she wound up qualifying for Medicaid.
Okay.
She eventually gets a job. I would strongly suggest you go on the website, look at the plans that we have.
Mhm.
If in fact you qualify for a plan and get covered, one of the things that I would say that you need to bear in mind is that any plan that you look at, as long as your son's doctors are in network, he'll be able to get attention in Philadelphia or in Pennsylvania, I should say. But they would have to be in the network. It doesn't mean that he has to come back to New Jersey as long as his doctors are in that network for that particular health coverage. But
Okay.
things that you want to look into as well to make sure so that your son doesn't have any problems. I think that it's definitely well worth looking at because he resides here. His domicile is New Jersey, correct?
Right now it is.
Right.
Right now. But then what happens if he moves?
Right, but if he moves, is he moving to become domiciled in Pennsylvania or as a student dependent with you? A lot of questions, right?
Yeah, I'm not really 100% sure. He's going to be still a student for another year at least. So, we'll still be supporting him to that level, but, moving in with a friend and who knows if he stays after he graduates and whatever, it's hard to say.
Well, it sounds
So-
like there may be some options there for you, right? And that you may want to decide like what his, legal domicile is for tax purposes and other things, partly on the basis of what it will mean for his healthcare, right? So look
Right.
at what getting covered in New Jersey would do for him. Look at the alternative I don't know if they have a state exchange in Pennsylvania.
Actually, I was just gonna say,
Yeah.
it just so happens that New Jersey and Pennsylvania, we both worked together to start our state-based exchange at the same time.
Yeah.
Pennsylvania's is called Penny.
Okay.
I don't know what kind of domicile requirement they have so that they would be able to purchase health insurance on their platform.
Okay.
You have the option. If he's going to be domiciled and working out in Pennsylvania, he may have to get it through them, or he could work, he can get it through us. But I would definitely, take advantage of all the options that are out there
Okay.
to see and compare it. Mhm.
Okay.
A lot
Thanks.
of it, like the congressman said, is like, where's he going to be filing his taxes? And, is he going to be considered a dependent under you and in that?
Right. Right. Okay.
Thanks,
Thank you so much.
Thanks, Rachel. Let's go to Roger in New Providence. Roger, can you hear us?
Yes, can you hear me?
Yes, we can.
Well, thank you very much for taking this time, Congressman and Marlene. This has been very helpful. Obviously, everything with healthcare gets, is always a top concern. With the new law and the new subsidies, because as we were talking about this, when I got the email, I was like, oh, I definitely want to hear what's going on. And I just went to the site and I just kind of went back in to do the compare, kind of put in my details. And it's now saying that I am getting credits, subsidies, but I put in the same numbers that I put to get the initial subsidies. And now it's saying that the subsidies are bigger. So, with the new law, and now obviously also with the fact that now, like as a self-employed individual, I also knew that like that 104,000 was kind of when subsidies would go away, but now the subsidies continue well above that, which is great. But with the subsidies now, as I said, it's probably about, I think it's $250 or so more in subsidies based on the numbers that I originally put in. Well, I just kind of collect that at tax time when I file my taxes.
So, Congressman, and please keep me honest here. My understanding is that what the subsidies retroactive,
Yes, it is.
you will be able to get when you do your taxes the following year. And then from the point that you start the new plan with the new subsidies, they will apply at that point on. So for example, you might have half the year with a lower premium because of the subsidies, the additional subsidies, and then the other half you would collect when you do your taxes. But
Correct.
please keep me honest.
Yes, that's correct. And obviously it's the sooner you renew your coverage, the easier this gets, right?
So I have to go back and like a resubmit on the site?
You would, I don't know how everything works out on the site. Forgive me for that. But you would have to, if you want to change your plan, you could do it. If you just want to go in and edit for your coverage, for your subsidies, there should be a button when you go in under your dashboard that would say
Okay.
edit. So that if you want to keep your plan the way it is with your doctors and everything, you can. It would just update the subsidies. And
Okay.
if there's any questions or any concerns, feel free to reach out to the call center. The number I
Right.
know is in the chat room.
Yeah.
You can go in, keep the plan that you have now, just update your
Okay, yeah, I don't want to change my plan. The plan is fine. We're happy with that. We've been on, with Horizon Blue Cross Blue Shield for many years, and that's fine. But again, right now, if you go into my personal page on Get Cover New Jersey, it shows that, this is your subsidy. And then based on, just kind of putting in those numbers as if I wasn't already in there, it's now calculating about another $249
Mhm.
subsidies. So I just want to know what I need to, if I need to do something. So I'll look on the website, and if I have any questions, I'll call the number.
absolutely.
I've called many times, and it's actually been very helpful.
Good. Feel free to call the call center to walk you through it. And also, if you go to your dashboard, also there should be instructions. And in the frequently asked questions, if I'm not mistaken, we even have screenshots of how to do it.
Okay.
Go
Thanks,
get those
Roger.
savings.
Thanks, Roger. Thanks, Marlene. Next up, we have Gordon from Westfield. Gordon, can you hear us? Gordon, do we have you? Remember to unmute if you are still muted. One last call for Gordon. All right, that's okay. Moving on. Let's go to Jean from Roxbury. Jean, can you hear us?
Yes, hello. Hi. Yeah,
Hey,
my
Jean.
question is I think I read enough information to find out that my answer, but I just want to see if I'm correct. I thought there was subsidies for people that have COBRA.
Yes.
The unfortunate thing is our COBRA as of April 1st changed from the regular COBRA, which was the 18 months. And since my husband got disabled during that time, it's now in an extension for 11 months. So it went up a lot for us, but I think we found one of these things where we don't get any help. Just that's my question. First, I have a zillion, but that's one.
Hmm.
It's a little, I don't
Yeah,
think there's a
not
lot
sure
of
if
people.
I
Yeah.
don't know if
So-
I can answer it just based on what you've told me.
Well, I thought, was I under this impression that there was subsidy help for people having for COBRA, but, and we had just, like I said, got off it, and I think it drops off, even though we really need it now because all the prices of the COBRA went up. And the reason, this is the other thing, is your answer should be, oh, we'll go to the exchange. I spent so much time on the exchange. And when you've had a transplant, it is really hard to get all your doctors, all your medications. And not only that, we've already paid out of pocket so much on this plan. So if you switch to another plan, I don't know, that was the other thing, is I don't know how that all works. I'm so happy I'm on the call now because you're saying that there's still, my understanding is there's 2 years right now this is planned for, that there's help for, is that correct?
Well, I mean, I was going to mention that at the end of the call, but all of the things that we're talking about here under the Affordable Care Act, under the state exchange, are valid for 2 years.
That's what helps me right now planning,
Yeah.
because
We're
I thought
gonna-
it was just a year.
We're gonna work hard to make this permanent.
Okay,
And in fact, we're going to try to settle that this year. And I think Congress would be hard pressed to take this away.
right.
But
Again, a lot of the costs is it's going to be, a lot of fighting there. But if I knew, now that I know it's 2 years, at least I can, if I can't get any help this year, at least
Yeah.
I know at the end of the year, I would be able to,
totally.
yeah, because
Yes.
then
And
it
on
makes no
top-
sense to try to continue COBRA because it's so expensive.
I think that's right. I mean, if you can make the switch, then, then I would encourage you to do it. On COBRA, we may need to talk to you individually, just look at this specific situation.
Okay, I don't want to take too much of your
That's
time
okay.
because I want it to
But
be
there are-
universal for a lot of
but
people.
there are subsidies for COBRA, and you're presenting something that might be complicated based on what you're telling me. So I think maybe just reach out to our team, and again, Nari can send you the link and the phone number. We can
That'd be
we can
great.
try to answer
Okay.
it directly. Thank you.
Thanks, but it is 2 years. I learned that today. I thought it was just
Me
for
too,
for 1
yes.
year.
Two, and hopefully, and
And it definitely says when I'm researching it that it does, it's supposed to be retroactive to January.
that's right.
Great.
Correct.
Thanks, Jean.
Thank
Thanks,
you.
everyone. Next up, we have Chris with a K. Chris, can you hear us? Chris, do we have you?
Yeah. Yes.
Go ahead with
Hello?
your question. Yep, go ahead with your question.
Honestly, now there were just a lot of questions. Is this if you go to newjersey.gov, get covered New Jersey, are these plans good for out of state?
If you go to getcovered.nj.gov, that'll show you the plans that are available in the state of New Jersey for New Jersey residents.
Actually, I'm sorry, Marlene.
Yes.
It's actually newjersey.gov/get covered. You keep saying it wrong.
It's getcovered.nj.gov.
I think they both work. They both work.
Yes.
Yeah.
You're
Actually, I
probably
tried
going,
to
you're,
do-
you're probably going on the state website for the state of New Jersey, and they're linked to us as well.
I tried that 3 times, didn't work, but okay, keep going.
Okay.
But go on. I'm just curious if it's the state, if you're on the state plan, if it's good if you go out of state.
If you move out of New Jersey, you mean, or?
No,
okay.
if you're traveling or if you're going
yeah.
someplace.
So if you, it's health insurance that you're purchasing, whether you're buying, like any other health insurance that you would purchase outside of the marketplace. If you're traveling and you have an incident, you know, the health insurance comes into play. Of course, if you go to a doctor, you know, you want to make sure that they're in network. You know, that's always tricky because you really don't know if your doctors, the network that you have in New Jersey are the same network that you would find, say, in Arizona, if you were traveling to Arizona. But it is health coverage the way you would buy any health coverage.
Yeah, that's true of any health insurance plan.
So
Right.
if even though I've got a PPO and something happens, get into an accident, the ER is taken care of, but all the doctors are not in my plan.
So there is a problem of surprise medical billing, right, still in our country, and we've begun to take care of it in New Jersey, and we have legislation in Congress as well to make sure that, you know, that particularly any kind of emergency treatment, right, you're not going to get hit by any kind of surprise bills just because your, you know, anesthesiologist is out of network. If you just need to see a doctor for a regular visit in our healthcare system, you know, with any insurance company, they'll have their own rules, right? And when you're shopping around for plans, that's one of the things, unfortunately, we have to do. Like, look at the network, look at where they have doctors, look at what you're likely to need based on where you live and how you travel and what your job is. And what we've done here is just to make those choices a lot more affordable for people
Right.
on the premium end.
And as the congressman said, here in New Jersey, we do have the out-of-network law, so that if you were to receive treatment here in New Jersey from a doctor inadvertently or by mistake in an emergency setting that is not in your network, you know, there's no surprise billing for you. You're removed from that. That would be something where your provider, meaning the doctor, and your insurance carrier will now have to deal with it. So there's no surprise billing here. That law was passed also under Governor Murphy. And from when it passed, it accomplished its intention, which was moving the patient, the consumer, from the matter.
That's
So
right.
that as long as it's not something where you acknowledged and knowingly went to a doctor outside of your network, at that point, then you would be responsible. But if it was inadvertent, an emergency situation, you are now removed from that. They will get paid whatever they would have to do. They would have to deal directly with your carrier, but you would not get a surprise bill. That's the out-of-network law here in New Jersey, as the congressman mentioned.
I appreciate you
Marlene.
being able to answer the question. Thank you so much.
Thank
All
you
right,
so much for
thank
being
you.
on with us.
Let's just take one more final question. And this final question is coming from Diana from New Providence. Diana, can you hear us?
Yeah, hi. Unfortunately, a lot of us got laid off early and spent our entire 401k on Obamacare. This is a brilliant plan, and I wish it had happened earlier. But now I'm between, I make a little too much for Medicaid, so I will be kicked off of that. I can't even afford the out-of-pocket $2,600. I've gotten no help on utilities, the utility for, so I'm in poverty after working and going to school and having a master's degree and having massive health problems. So I wish that the Medicaid limit had gone up to like $24,000 or something. So there's gonna be many of us that that are going to have our utilities shut off soon. Because instead of giving a monthly credit, they gave $200 and I owe 14. I applied for rental assistance and didn't get it. So after working hard and having a good job, I find I'm in poverty, but now I'm not in enough poverty to still afford this. What do I do?
Well, have you looked, unfortunately, it's not retroactive before January 1st. And you're right. I wish we had done this last year. I don't want to get too political, but we had different leadership in Washington, right? We
Right.
had an election and it made a difference. So here's what we're doing now. Have you looked at the New Jersey website to see what you would be paying for different kinds of coverage now?
Yeah, I did. And I don't have 2,600. And everybody keeps saying there's so much help out there in New Jersey. But the rental help that the federal government just gave New Jersey lots of money for is based on a lottery. So I didn't get rental help. Most of us have gotten little to no utility help, and we will be shut down.
Congressman, if I may, Diana, did you go to the website for the Department of Community Affairs, which is headed by the Lieutenant Governor? Because I know that they have different programs there, and they run the program for electricity to be able to have, to help.
Yeah, they're offering. Yeah, I went through that, believe it or not.
No, I believe you. I believe you. It's these are tough times that we here in New Jersey have not seen it. And I am really sorry that you're going through this. What about in your county? Most counties have offices that are called homeless prevention, and they help with a couple of months.
Nobody picked
Right.
up the phone.
I'm
Yeah,
sorry?
no, I know, but nobody's picking up the phone. But if I get kicked off of Medicaid, and I go on this New Jersey covers, does it mean that I automatically go back to January and owe like 2,600 out of pocket, or?
No.
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 If you were to go to getcovered.nj.gov and look at the different plans that are available based on your income, if you're making more than what is allowed to be on the Medicaid, like I said before, you might find a plan where it's $10 or less. It all depends on
Yes,
the
those
plan you're looking
they're
at.
out there, but there's still a huge deductible and out of pocket for 2,600.
I understand I definitely understand your frustrations. And I know it's hard to see all the work that you're doing and then all of a sudden you're in this bind. And I'm just trying to think from my experience as a private attorney, because I was an attorney prior to becoming the commissioner of the Department of Banking and Insurance. And I know that in most courthouses, county courthouses, if you go on their website, they do have a list of associations and organizations that can help rent. Now, they won't, they might help you for 3 or 4 months, but it is assistance that's out there and it is available. And if you went into the like, for example, the county that you're in, their courthouse, and you looked under landlord tenant, they will have a list of associations and organizations that can help any kind of rent assistance that you may need. And again, homeless prevention in most counties, it's an organization that exists. I understand it's difficult to get through to folks because of COVID. Most folks are not working at the location. However, most courthouses do have individuals there that might be able to pick up the phone and help you.
And Diana?
Think of places. And of course, there's the congressman's office.
Yeah. So, sometimes like the best thing we can do for people is just to get someone to pick up the phone for you, right?
No.
So why don't we, if you're willing, just to talk to us separately, and Nari will send you that link. We'll see if we can help you figure out what resources Union County might have to help. And look at that Get Covered site. Maybe that plan for $10 a month has a super high deductible, right? But maybe for $50 a month or $100 a month, you get a much higher quality plan that's still heavily subsidized. So there may be some options there for you where you're paying a little more a month, but you don't actually have to pay $2,600 immediately the first time you need some expensive healthcare. So you need a higher quality plan, but it will still be heavily subsidized. So anyway, why don't we, if it's okay with you, see if we can help you out separately.
Yeah, Diana, a few minutes ago, I direct messaged you our casework form. Fill that out. Hopefully our office can help you out. If you are in employment or need help getting in touch with unemployment, if you have housing issue or you're trying to get housing figured out through the housing department, please reach out to us. I direct messaged that to you just about 5 minutes ago, but let me put it again for everyone in the chat. That is malinowski.house.gov/casework. We can help you guys out with any federal agency and hopefully get as many constituents as we can back on track.
Yeah, that would be great. But thank you for doing this, because so many people have just lost their retirement, paying for Obamacare and just trying to make ends meet.
Of course. Yeah, reach out to our office.
Thanks so much for sharing that. It's tough, and so many people have experienced a hard time, especially in the last year. Our job is to help wherever, when it's humanly possible. So we'll do our very best.
Thank you. Thank
Thanks.
you both. Thank you everyone for this conversation. Thanks, Marlene, for joining us. I know our district and Tom's office really appreciate it. I will turn it over to you guys to close us out for any closing remarks. But again, thank you everyone for joining us today.
Fantastic. Thank you, Nuri. Thanks everybody for coming on. I think the basic takeaways here, we've made a lot of progress. I imagine almost everybody on this call is going to be saving money on healthcare because of these changes. But the system is still too complicated, and this, as a country, we're still paying too much for healthcare, and so we're going to need to do more. What I would ask of all of you is, if you think that there are some good opportunities here, at least in the short term, for people in New Jersey to save money on healthcare, please spread the word about this. I think much of the attention around the American Rescue Plan was focused on things like those stimulus checks. We want to get our $1,400 check, right? That was in the headlines. This is like 10 times more important in terms of the good that it can do for people, but it didn't get as much attention. So I want to make sure, and I would ask you to help us spread the word and make sure that everyone who may be in this situation is aware of the resources that are now out there. And I will fight like heck to get this made permanent and to build on it with deeper reforms. So thanks so much. And thank you, Marlene, for spending overtime with us and for answering all of these questions.
Congressman, thank you for all the work you're doing in DC, and thank you for making the American Rescue Plan a wonderful possibility for New Jersey residents. Thank you.
All righty. Bye, everybody.